Well, we're all going through a difficult time right now due to the COVID-19 virus. Our daily lives have changed significantly because of the presence of this particular virus. And so, what I want to talk about for the next few minutes is kind of how we handle the stress or the threat that comes from this invisible enemy. You know, our bodies are kind of hardwired for a typical way to deal with stresses and threats, and that's called the fight or flight response. And what that means is within a very short period of time of being faced with a threat or a stress, our mind makes one of two decisions. Either A, we stay and fight it, or B, we head for the hills. Unfortunately, when we're dealing with an invisible enemy, where do I flight if I'm going to flee? And if I'm going to fight, what actually do I fight? Within us, we have our own internal and external stresses. Internal stresses are basically those ways that we deal with stress. External stresses are things like stuff that affects our jobs or affects our economy or affects our own health. Now, there's two ways basically to respond to any kind of a stress. Let's talk about unhealthy ways and healthy ways. Unhealthy ways are things like just to sit and worry about things. You know, watching the television or listening to the radio on a daily basis of what the COVID-19 virus is actually doing here in the United States is a very concerning and threatening thing. We walk around with masks on our faces. We all have hand sanitizers in our pockets or purses. And so definitely when we listen to the media on this, it's easy just to sit back and worry about things. Yet that's not a healthy way to deal with that kind of stress. Sometimes it's just I get mad because of it. You know, anger is really fear turned outwards. And although we all need sometimes a little motivation to do something, in this case to either fight or to flee, just getting mad at something without really knowing what you're getting mad at, or getting mad at the government, or getting mad at the way that our economy is right now as a result of it, again, is not productive and not healthy. Sometimes, though, our reaction is to retreat into isolation. And when we're talking about isolation, you know, again, part of the response to COVID-19 has been what is social isolating or social distancing. I'm not talking about that. What I'm talking about is basically hunkering down in a hole and hiding, just like you would maybe with a tornado. But a tornado is one of those events we can see and we know it's coming, and we can then shelter ourselves for a brief period of time. But for COVID-19, that's likely to be with us for a while yet to come, hunkering down to not do anything, again, is not a healthy response. Sometimes, though, our response is, well, who cares? I'll just do what I want to do. Well, the problem is, again, in dealing with that stress in this particular way, we're not being fair to others, because part of the reason that we wear the masks, part of the reason that we use hand sanitizers is to not get the virus and therefore give it to somebody else. So a who cares attitude, again, is not a healthy way to deal. How are some healthy ways to deal with it? Well, first of all, I think it's important to separate what's real from unreal. You know, when you look at the statistics that are present as a result of the virus, the prevalence, in other words, how many cases are present at a particular time in the United States, is about 35 in 10,000 people. So for every 10,000 people, 35 of those have the virus. So I think the first thing to do is that if watching the media provokes your fear, turn it off. Turn off the TV. Stop listening to the radio. Because again, all that does is put fear back in us about, well, really, can it get as bad as New York? I suppose that it could, although that's quite unlikely. Sometimes And again, it's important to avoid the victim role. In other words, oh gosh, I've got it. Isn't it terrible? Well, again, that's not healthy. The healthy way is to say, okay, I've got it. What do I need to do to protect myself and to protect others? We talked a minute ago about social isolation versus isolating yourself to hide from it. And again, I think when we look at social distancing, yes, it's important to keep away from other people in terms of being close or part of. But again, get outside, go walk, go on your usual activities, because it's important to keep up your daily routines during this time. Avoid the extremes. Avoid the let's hunker down and hide from things, or the other extreme of who cares. Certainly in the middle is where we need to be, but not at a point of worrying about things. Sometimes if that worry gets to be too much, that's why we're here. And that's why your family doctor's here. We are here that if you are having trouble dealing with all of this COVID-19 stuff, come seek us out, come talk to us, because again, we have some ways that may be able to help you come through this time in a better way.